Tonight, health professionals are urging people to stay up to date with their measles vaccinations. It's because the first case of measles in more than 10 years was confirmed in Kent County. And that now brings us to two confirmed cases here in Michigan, with the other being in Oakland County. News Channel 3's Mackenzie Decker spoke to doctors today, and Mackenzie, they're expecting it to only get worse from here.
Yeah, that's right, Princess. Health professionals are saying that this specific case is a reminder of just how quickly measles could spread. Not only are they telling people to get vaccinated, they're also answering a long list of questions surrounding the disease. The first measles case confirmed in Kent County.
Measles is one of those illnesses that really concerns us as emergency physicians because it's incredibly contagious.
The infected adult recently returning home to the U.S. after traveling abroad, making stops between Michigan and New Jersey. The total number of confirmed cases in Michigan now standing at 2. But Dr. Todd Chassie, medical director of the Right Care Clinic, expects this is just the beginning.
And unfortunately, with the outbreak that we saw in Texas, I think with travel, only a matter of time before we saw the potential spread.
Chassie and I sat down going through a list of questions, starting with the basics. How is measles spread and how contagious is it? Chassie went on to say the disease lingers in the air and on surfaces for up to 2 hours after an infected person passes through an area. Chassie also touching on the list of symptoms to look out for, including a high fever, red, watery eyes, a cough, and runny nose.
It has a characteristic rash that often will start on the face and spread. So it can look like other viruses, especially early in the course.
We then moved our conversation into who is most vulnerable to the disease. Are people who may have had measles in the past, are they not susceptible to it anymore?
Great question. People who've had measles, again, have immunity against the measles.
Chassie says that means people born before 1957 are not at risk because they were likely already exposed. But he says if you were born after 1989, you're eligible for a booster, even if you were inoculated in school. In the end, Chassie says getting vaccinated is just as much about protecting yourself as others.
Vaccination, and vaccination, especially for protecting those who aren't able to receive vaccines for medical reasons. So I think that is the most important thing that individuals can do.
Now, this is just some of what we talked about today, but Dr. Chassie had a lot of great information on measles. It's why we're going to have the full interview posted on our YouTube page for those who are interested. Live in studio, Mackenzie Decker, News Channel 3.